for Providence. As a reminder, the information provided during this event today is for educational purposes only. If you have any questions regarding medical conditions or treatment plans, please talk with your doctor. Now, let's get started. It is going to be such a great conversation today. We have some amazing guests. Joining us today is Providence foot and ankle specialist and surgeon, Dr. Keplinger from St. Jude Heritage Medical Group, and professional MMA fighter, Kat Zingano. You may recognize Kat's name and face, so we're so excited to have her for her expertise on this. And Kat, for people, let's get started with you. For people who don't know you, don't recognize your name, who are you? Give us a little bit of background in your story.
So I'm a professional mixed martial artist. I've been doing combat sports since I was 12 years old. Right now I am currently ranked number 2 in the world. I'm about to fight for the title early next year. And I was the first mom to have a professional fight in the UFC. I was the first best fight of the night, which is all of the fights combined, women and men. We won best out of the whole night of everyone. As the first TKO, which means the first stoppage of a fight basically in the UFC, and just been around the block as far as these combat sports, and been an athlete in different sports my whole life, which kind of materialized into me doing what I'm doing now. And now I'm just sharing and importing and exporting my experiences.
We are so grateful to have you, and thank you for giving us that perspective of your amazing accomplishments, and both on the personal side and, of course, with your career. Dr. Keplinger, you are also just such a star as a surgeon and a physician. Talk to us about your background. What got you into medicine, and what you do?
Yeah, no, thank you so much for having me, and for Kat for joining us. So I am originally from Kansas, now living in Southern California. And I decided I wanted to be a doctor at age 4 when I broke my arm jumping off a swing set. And I saw the x-ray, I saw my bones, and I'm like, I'm in. This is it. So culmination, actually, it came to fruition for me. I did my medical training in Iowa, a residency in Virginia. I did an orthopedic foot and ankle fellowship in Portland, Maine, and then came all the way across the country to Southern California to practice. I have a very thriving practice from geriatrics, adults, sports, pediatrics. I really see it all, from the sports medicine to the complicated reconstructions to I have heel pain, plantar fasciitis. Here I met my husband, and I have 3 young children. So being a mom, surgeon, wife, all those things, it's a busy life, but I love it.
That is great. More amazing experience. I love having 2 powerful women on a show like this. It's great to have your perspective and your experience as we talk about feet, ankles, and really overall body care. You both are experts on different sides of the coin. So, Kat, let's go back to you. As a professional athlete, how do you take care of your body and keep your feet and ankles healthy too?
Well, it was definitely a learn the hard way kind of experience with this sport, let alone all of these sports. When I was little, we didn't always have money for the new shoes, so we would go to places like Play It Again Sports, and my mom would usually buy cleats that were a little too big, and we'd stuff the toes, or we would just let them be. And I remember always having heel pain or always having toe pain or whatever, but I would take it just so I could run, and just so I could get the ball, or just so I could be on track, or just so I could be in tap dancing or whatever. And always using my feet, always tapping my feet, always into something. And as I've gotten into MMA, this sport is primarily barefoot. You walk on the mats, your shoes stay on the side. You get off the mats, that's when you put on your flip-flops. So it's a lot of running around, and even the mats matter. Even the shoes you wear in between matter. Even, if you have an injury on your toe, I mean, it's a running joke, but I would almost rather break an arm than break a toe, because of how much you have to be on your feet and using that toe. You can't leave it alone if you're going to go about your day. At least with an arm, you can put it in a sling, or you can lay it on a pillow or whatever. But your feet, in order for you to function, you need to be on them. You need to be using every little digit. And it's a lot. It's something that, I have to get massages on them. I get reflexology. I've had broken toes. I've had broken capsules. and having to constantly adjust so I can still do what I need to do or get ready for a competition. Meanwhile, find a way to not limp, because if I limp, it's going to throw off my hip, or it's going to throw off my back, or it's going to throw off my neck, or any of those things. So they really are a huge foundation for everything going right in keeping good care of your feet.
Yeah, that's so well said. And I feel like, at least personally, I don't always think about my feet. Like I'll spend a lot of money getting whatever else it may be that's nice. And I'm like, oh, I'm an athlete. I'll get, some fancy shirt or something. But then I skimp on my shoes. But that's at the core of whatever we're doing.
Mm-hmm. Yeah.
Is there, Dr. Keplinger, as we talk about, whether it's preventing injuries or dealing with injuries, is there any misconception that people have about foot and ankle injuries or about preventative care? What do patients come to you with questions about?
Oh, well, I get questions about almost everything, foot related or not sometimes. But I think the common misconception is when your foot hurts, that it's not really just your foot. Most of the tendons and muscles that control your foot and, give you strength and give you power are actually in your calf and in your lower leg. And so a lot of times when I'm educating patients about while they have midfoot pain or while their toe really hurts or while they have heel pain, we're talking about the anatomy of what's going on and what tendon or bone is involved. But I'm also educating to, as you go up the leg more proximal to the calf and the muscles up there, they tend to, if they're off, the rest of the foot is off. And so you have to treat kind of the whole lower extremity. And as Kat said, if you're limping because your toe hurts or you have a bad bunion or heel pain, then your hip, your knee, your lower back, everything kind of compensates for that. And then that just, it's a cyclic cycle that just keeps perpetuating itself to a certain degree. So even though you have a broken toe, that tendon to that toe is probably up in your leg. And so kind of addressing all of it is important.
Wow, that is fascinating.
Mm-hmm.
Are patients surprised when they hear that from you?
Yeah, it's a very big aha moment. I think heel pain is probably one of the most common things that I treat. And, when I discuss how stretching your calf muscle will significantly reduce your pain and prevent it from getting worse or prevent it from coming back, I get a lot of a really, but it's my heel, doc. Like, how does this help? But they come back 2 to 3 months later, they've done the stretches that they're required to do, and they feel a lot better without injections or things. And those things have their place. They definitely are part of a treatment protocol, but that calf stretching can be so crucial to a lot of things in the foot and ankle.
Interesting. Kat, is that something that you do in your practice of preventative care, stretching and that kind of thing?
Yeah, absolutely. In the beginning of a practice, I will walk around on my heels only. I'll walk around on my tiptoes only, do the things against the wall, roll them out. Especially I have to go into different gyms sometimes, and there's different quality of mats. I've actually had to walk out of gyms before because they have mats that I can tell, like, when I push off, it's straining too much because there's not enough softness to them. If it's too hard, and if I'm basically trying to do like a shot or a lift on concrete versus on a pillow, my foot is gonna grip differently, and I can walk out of that place feeling like I tore something on the bottom of my foot, or wake up the next day and my feet hurt bad, and I don't, that's the only thing I can think of as to why. And yeah, my whole life I've always been a bit pigeon-toed, and there was a debate when I was growing up whether or not do these chiropractors want to fix it. Because on one hand, having my toes turned in, they said gave me some athletic advantage because I'm faster and which I don't know if it's true or not. And if I change them and move them out where they're straight or even a little bit more duck foot, I guess. Is that beneficial to me and my growth and my posture, and how am I gonna develop and all of those things? So orthotics at a very young age too as well. So, those insoles that they put into your shoes to make it where your feet don't hurt or you walk properly. Those were always a thing too. So there's always been a ton of work that needs to go into that in order to just have the quality of life that you're trying to ask out of yourself, especially if you're standing all day, or if you're, trying to be in sports, or if you're, I don't know, just going for runs, all of those different things.
Yeah, it's so relatable, whether you're a professional athlete or just, again, someone who likes to run for fun, or maybe you're a bartender on their feet all day. And I love what you're saying about listening to the body. And Dr. Keplinger, we'll go back to you. What are some things that people can do to prevent injury? As we talk about this, obviously listening to your body is one thing, but what else can you recommend for people listening?
Well, I mean, I think listening to your body is key. The when you start to have an ache or a pain, a lot of times we just ignore it. It's something it's the mat I'm walking on, it's the shoe that I'm wearing. There's lots of excuses that we make. But one of the best, preventative things you can do is to go see a specialist when you start to have your first concerns, because there's a lot of conservative treatments out there, from stretching, orthotics, physical therapy, injections, medications that we can prescribe that help kind of nip it in the bud in the beginning, versus letting it continue to progress to something that eventually might need surgery. And sometimes, surgery is needed in the beginning anyway, but for the most part, a lot of things in the foot and ankle, when caught early enough, or you do have good care, can lead to a successful outcome without much intervention. But it's really important to look at your shoe choices. As Kat was saying, if you're in too big, too small, if there's not enough support, what Kat does, she needs all the intrinsic, the muscles inside in her foot. She needs as much strength there as possible. So her shoe choice on the day-to-day is going to be different than someone who's constantly been in shoes and hasn't had to develop that muscle strength all of their life. And so it's important to understand kind of what your foot needs and the job that it needs to do with you every day to choose the appropriate footwear.
That is such great advice. Appreciate you sharing that. It's kind of a puzzle to figure out what works for your body. Now, I know both of you mentioned you both are parents. Kat, we'll start with you. I've read about your son being really active, and you post wonderful photos of you two bonding. And how do you promote this wellness with him and help him prevent, ankle and foot injuries as a kiddo or a teenager, I guess?
Well, I kind of talked to him about, because getting good at something is hard, right? Especially in the beginning, you have to know and be receptive enough to not know anything and be around people that know more than you, and either be patient enough to make mistakes until you make less mistakes and then you're getting it, or ask questions. And so, with my son, I try to encourage those tough moments, those hard moments, and be isn't it fun to be getting better at something? Or isn't it fun when you're good at something? And the only way to get good at something is to repeat, and try and fail, and don't quit, and figure out how you work at it, and you don't have to be the same as everybody else, but you have to figure out how you work. And so that, again, it's kind of nice to have all the trial and error in my life, so he doesn't have to have as much trial and error. Not that was the easy thing, but I can explain a lot more to him through experience and through figuring out, this is how I work and this is how I don't work, but I've seen this work for this person, so that's an option. But this is what I know to be true about me. This was true about them. Let's stick to the things we've either seen work, we've heard work, or we've made work, and build off of there, have a foundation off of there.
That's amazing. It's so cool to hear about the connection you have with him and that open line of communication. Do you have conversations about, keeping his body healthy and making the right choices? I know when I was a teenager, maybe I pushed myself too hard and caused injuries because I didn't know my limits. Do you have to have conversations like that as a mom?
Yeah, I try to guide him, and so it's his hands doing it. If we go and we do a strength and conditioning thing, we'll walk over and it's okay, this is when you have protein, is right after this, and when we get home, you shower, and then you can kind of stretch out with these tools, these rollout balls or these different things. When he doesn't get pedicures with me, but when I go to a pedicure and he has to sit there, I tell him hey, I don't get rid of, when they're do you want me to do the callus removal? And be no, I actually need those. And they look at me a little weird, why would you not? Okay. But I need them. I need to twist. I need that to catch on the mat. I need it to not be so soft that it eventually hurts me, things like that, where it's these are things I need. This, if I want to do this and I want to perform this way, we're going to need to take these steps. We're going to need to take these vitamins. We're going to need to get this amount of sleep. We're going to need to eat this before we go compete at something. You're going to need to be around this type of energy, and you're going to need to conserve this way, and you can afford to expand in this way, and just trying to walk him through the things. So when and if he wants to do this stuff on his own when he's older, and have these resources as something that he can go do with or without me, he knows what he's doing. He has the option, he has the information, whether he wants to, cook his own meals or go to McDonald's, he at least has the information.
Yeah, it's what parenting is all about, giving them the right tools. Dr. Keplinger, as a surgeon and a specialist in this field, do you have those conversations with your kiddos? I don't know how old they are, but about keeping their feet healthy, and what advice do you share with them?
My kids are very young, 3, 4,
Okay.
and 5. So we don't necessarily talk about specific stuff, but they have, there's certain preventative things about, we have these large goat head things in the yard. So I'm like, please don't run out without your shoes on, because pokies in your foot really hurt. And so, kids learn very experiential. So they learn from their experiences. So it's easier to course correct at this age when they have an ache or a boo-boo, and you can kind of educate them to why it happened and why they shouldn't be doing that again. But education is key. I spend probably most of my time with patients is educating them on why they're having their pain, what they need to do about it. I'm sure patients sometimes are like, okay, stop talking, I need to get out of here. But I feel like they will not be able to fully implement a treatment plan unless they understand why they're there and what the issue is and how they're going to fix it. And so I try to strip everything down from the basic anatomy to the biomechanics to the treatment plan so that they know why they're doing and why this simple stretch can significantly improve their pain.
Ah, that's amazing. But before you even have that conversation, we got to get them in the door. So at what point do I, as a possible patient, do I say, okay, this pain is getting too bad, or I'm just having really weird issues? At what point do I land in your office?
Really, at any time. There's some patients that I have, they're like, well, I had this pain, I wasn't sure what was going on, it's gone away, but how do I not have it come back? So through the investigation process of figuring out the history of the issue, we can talk about the anatomy, and I can say, hey, this is probably what you had, and this is what you can do to prevent it, all the way to, I broke my ankle, and so obviously I need immediate attention, and we address that and do surgery or conservative care based on that treatment. So whether it's a small ache or pain, something you've been having that's bothering you for a while, at any time, I think it's important to seek the information from the specialist to make sure that you're getting the appropriate care.
That's so smart, and something Kat was talking about earlier too, about her journey. If someone's listening or watching right now and they're in Southern California and they're really resonating with what we're talking about, they want more information about your office, your clinic, how do they get in touch?
Great. So the direct office number to get a hold of our orthopedic office and to get to me is 714-626-8630. Obviously, on the Providence website, type in my name. All the things will pop up about how to make an appointment too. But we're definitely accepting new patients, and I'm excited to continue to do what I do and help people feel better. The foot and ankles are such a foundation to your health and to activity and to doing the things that we love. And so I like to keep people on their feet.
I love that. And it's clear you have such a passion and talent for this. So thanks for sharing your words of advice. As we close out this conversation, I just want to give you both one more chance. Is there anything else, if there's one takeaway that folks have when they listen to this conversation, what is that takeaway? We talk about foot and ankle health. Kat, do you want to kick us off?
Well, for me, I think stubbing a toe or twisting an ankle or something, I think there's a very big difference in when something is injured and when you maybe just hurt it. And I think if you hurt it, for me, I'll give something, if it's just painful, I'll give it a couple days, and if it doesn't change or get better, it's time to go get help, and it's time to talk to someone that knows more than you. I think with an ankle or anything that's swelling or anything that's, red and puffy and turning colors, like I also think that's a good time to go in and get checked out. Better to be safe than sorry, and wish you had gone in sooner than sit at home and be tough about it. There's nothing tough about sitting there being in pain that you don't need to be in. Going and getting help and getting it fixed. You're never going to regret getting it fixed or getting it helped or healed when you could have in the beginning. You don't want to build up pain tolerance. You don't want to build up some kind of tissue that's going to make it harder to deal with.
Such good advice, especially coming from you, given your career and what you do. It's awesome to hear that words of advice of it's okay to get help and don't tear your body up. There's
Mhm.
support out there. So appreciate you sharing that, Dr. Keplinger. Your last thoughts on this topic?
Um, yeah, just echoing what Kat said. Your feet and ankles are so important to your health and your well-being. Um, it's important to get it checked out. After a couple of days, if something's not getting better, then yes, talk to your primary care doctor, get a referral to see a foot and ankle specialist if needed. Um, sometimes I get questions about, what happens, doc, I have an injured left foot. How do I keep my right foot from having this happen? So a lot of times when I do conservative treatment, I say, well, if you're stretching your left, you should probably stretch your right too. If you're non-weight bearing because you have a fracture or, severe tendonitis or something along those lines or had surgery, you're doing a lot less activity because you're non-weight bearing. So that ultimately decreases some of the stress on the other side. But it's important to implement, at least from a biomechanics standpoint, if you're treating one side, try to treat both because you don't want an injury hopping back and forth because you're overcompensating too much on the other side. So I think just making sure, you do have 2 feet. So make sure that you don't focus too much on one side and that you treat both as needed.
Such great advice. This has been such an amazing conversation. I'm inspired to take better care of my feet as I think about going to the gym tonight. So, thank you both for sharing your experience, both professionally and personally. We're so lucky to have you as our thought partners in this conversation. So, thank you everybody for listening. And if you are in Southern California and looking for help with your feet and ankles, of course, you can reach out to St. Jude Heritage Fullerton Podiatry, or you can always visit providence.org and search podiatrist. Thank you all for listening and tuning in, and thank you to our amazing guests as always. We'll see you next time.
Thank you.